Thanks so much for joining us. We know people will still be coming in over the next few minutes, but I want to welcome you to the American Indian and Alaska Native Prevention Webinar Series. Today we have Dr. Wendy Gardner and Elizabeth Neary presenting on building resilience in our patients, communities, and ourselves in a time of COVID-19, lessons for behavioral health providers. If I can get my slides to go. There we go. This training series is brought to you by the National American Indian and Alaska Native Prevention Technology Transfer Center. We are part of the PTTC network, which also includes 10 regional centers, the Network Coordinating Office, and the National Hispanic and Latino PTTC. And I don't think I said, but my name is Kate Tram. You might have, lots of you who are on probably have gotten my emails over the years. And we also have our program coordinator, Cindy Sago, is on as well. So she's helping us coordinate this event. In the next couple of days, we will send up a follow-up email to everyone who attended, which will include a link to the recording, handouts of the slides, and a CEU request form. I wanted to note, because people were asking about CEUs, we do, in our follow-up email, you will get confirmation of your attendance and the number of CEUs or number of hours that this qualifies for. So for many licensing bodies, that will be sufficient. But if you want to have an official certificate, we do ask for $15 just once per year for any of our webinars that you attend, and we'll create a certificate for you and send that out to you via email. Immediately following our webinar today, you will be redirected to our GPRA evaluation. This survey takes just a few minutes to complete, and it asks about your satisfaction with the event. We just wanted to put it out there that these surveys are really helpful. We've been we really utilize this information on planning our programming, and so we would love for you to take a few minutes and let us know what you thought, and if this was important to you, we would love to hear that. So thank you. You will be muted for the duration of this webinar, although we're going to talk about some options at the end when we're having some more discussion. So during the presentation, if you want to use the chat pod to enter any questions or comments, please feel free to do that. And then Dr. Gardner was pointing out there's some options up at the top if you see the little person raising their hand. At the end, when we're opening up for discussion, you can use that raise hand option, and we can give you the ability to connect your microphone so you can ask your questions that way. So we'll explain that again once we get to the end, but you can also use some of those options in that menu to give some feedback during the event as well. And I wanted to mention too, if any of you want to share your faces with us, it's great to see people's faces and to see some reactions and to know how people are feeling about the presentation. So any one of you can also share your webcam with us if you go up to that camera pod and then to the menu on the right hand corner up in the top right, and you'll see the option to start your webcam, and then you can click share, and then we'll be able to see your faces as well. So feel free to do that. We'd love to see some feedback into, just to get some ideas of how you guys are feeling about what we're sharing today. I did want to take a quick minute to mention right now we are recruiting for our program for the Leadership Academy. It's a year-long program where we have 3 different face-to-face meetings, and this is a really great opportunity for networking with other behavioral health professionals in the field, and this is specifically for Native American professionals, so we want to encourage any one of you who might be interested in that to consider this, and you should be able to click on the link there on the bottom, but I'll also put that in the chat so you can check that out later too. And then I wanted to introduce our speakers for today. We have Dr. Wendy Gardner. She's a member of the Stockbridge Munsee Band of Mohican Indians, and she's a public health professional and clinician. And in 2019, she founded the Good Medicine Tribal Public Health consulting services to support tribes and their allies in promoting tribal health and healthcare across a wide array of topical areas, including preventing and treating substance use disorders, healing trauma, and promoting indigenous resiliency. Good Medicine donates 7% of its resources to growing the next generation of Native public health professionals and to tribal nations in need of support but lacking resources. So we're so excited to have Dr. Gardner on, and then we also have Elizabeth Neary. Elizabeth is a staff clinician at Emory University's Counseling and Psychological Services, where she provides individual therapy, group therapy, and outreach to the campus community. She is an advocate for social justice and was given the opportunity at KSU to work with students who are homeless or in foster care to overcome barriers to college completion. We're so grateful to have Wendy and Elizabeth joining us and sharing their experience with us. And so I want to welcome you both and want to welcome all of our participants who are joining us. And I'm going to pass things over to Wendy and Elizabeth now. So I'm just going to pull up their slides here just a moment. Okay. All right, thanks so much, Wendy and Elizabeth, and yeah, we're so excited to have you here, so thank you for being here.
Thank you so much for the warm welcome and lovely introductions. Good morning, everyone. Good afternoon, everyone. My name is Dr. Wendy Gardner, and I'm a member of the Stockbridge-Munsee Band of Mohican Indians. We are a people where the water never stops flowing. And today we're here to talk to you about how you can build resilience in yourself and in others during this time of COVID-19. And, you know, Elizabeth and I want to be really clear that we are by no means experts in COVID-19. But what we can offer you is our perspectives as clinicians. Like Kate mentioned, I am a former physical therapist and current public health practitioner who works mainly with Indigenous people and our allies. And Elizabeth is a counselor and public health practitioner. And as many of you, has moved from doing her work largely in person to virtually. Also, like Kate mentioned, about a year ago, I started an organization called Good Medicine to promote tribal public health and healthcare. And through this work, have witnessed, you know, just how this pandemic is affecting tribes and tribal organizations across Indian country. Today, we're going to do our best to share what we've learned, and we're going to allocate some time at the end for questions and for discussion so that we can hear what you've learned and about your experiences at this time.
We're connected again, sorry.
Of course, that's all right. Oh, technology. Well, I'm going to have Elizabeth introduce herself, but she's done a lot of work with trauma-informed care. And so she's going to share a great deal about that work that she's done in this presentation. So, you know, in this presentation, we're going to talk about the experience of living in this time of COVID-19 and discuss how many of us have been impacted in terms of our health and our well-being. And, you know, we're going to pay special consideration to the experiences of American Indians and Alaskan Native people. We're going to discuss how trauma-informed care practices may reduce or prevent trauma responses. And we're going to share some ideas for you to consider about growing your own resilience, your clients' resilience, and your community's resilience. So, for many of us, living in this time of COVID-19 is associated with an increase in uncertainty and stress. You know, we might be worrying about our own health, the health of our loved ones, our financial security, and all of those unknowns as we're navigating this new normal. And we know that human beings under acute stress, that we're more likely to operate from those survival areas of our brain. Oftentimes, it's hard to plan in the future, but we often are kind of focusing on the here and the now. And we also know that during times of acute stress, it can be harder to regulate our emotions when normally that might not be an issue for us. That being said, not everyone reacts in the same way to stress and trauma. And one goal for us as providers and just human beings living during this time is that we might want to consider how we can prevent and mitigate the lasting effects of stress and trauma. So, this is something that Elizabeth, often even Portas, best explains the different adaptive responses that we all have in our nervous systems. This theory also underscores why creating a safe and consistent human connection is so important to resilience. When we come across a traumatic event like COVID-19, our brain's first instinct is to bring online the social engagement system, to look for safety by connecting with others. However, if we cannot find safety in others, our brain will next turn on the sympathetic nervous system, better known as the fight or flight, where we experience many of the symptoms that Wendy, me, was just describing. We may also experience increased heart rate, sweating, shortness of breath, all responses that are, physically getting us ready to fight or flee in a situation. A lesser discussed response, but potentially one when faced with a life-threatening event, is a shutdown, when our body and brain conclude that there's no way out from the trauma and fight or flight will not work. Our nervous system will activate the most ancient survival mechanism, a dorsal vagal response, known as the freeze or collapse. During this response, the person might freeze, unable to move or physically collapse, and experience lower awareness of the surroundings and self, i.e. dissociation, and experience a decrease in physical pain. It's important to understand that these responses are not chosen, that they're hardwired in all of us. They're adaptive in a moment of life threat, and that you can see all of them in varying degrees in your clients. In attempts to bolster resilience in our clients, ourselves, and our communities, we must help strengthen our social engagement systems through connections to one another. Now, before we can start talking more about resilience, we believe it's important to discuss why this pandemic may be particularly triggering and traumatizing, or even re-traumatizing for Indigenous peoples. Although this can be challenging at times, we believe that there's tremendous value in stepping into these difficult spaces and talking about this topic, because we know that it can be affirming to be able to identify and put words to traumas that may be coming up in us and manifesting in us during these times. And that's really powerful. So when we're thinking about why COVID-19 may be particularly traumatizing or re-traumatizing for us as Native people, something important to note is that for the Indigenous people of Turtle Island, we're not strangers to infectious diseases and the impacts that they can have on our communities. During the 16th and 17th centuries, we know our Indigenous populations were reduced by colonization, conquests, and infectious diseases, such that Indigenous people on Turtle Island went from being 100 million to 10 million. Now, like I said, Indigenous people are not strangers to pandemic disease, and some believe that our cells remember, and our blood remembers, and our bones remember. We know from the science of epigenetics that chronic trauma for people that they experience in their lifetime can actually mutate our genes, such that the mutation results in an overactivation of our stress response system, and that this mutation can actually be passed down across generations, such that the traumas of our ancestors can become our traumas to bear. Now, even though we've experienced pandemics before, Indian country is largely unprepared for COVID-19. The scale of the pandemic exceeds the capacity of many tribal nations to address it. The Indian Health Service, the federal agency who's responsible for the health of American Indians and Alaska Native people, has historically been underfunded to levels where it struggles to provide even some of the basic healthcare services that we need. And now in this time of COVID-19, the cracks in this system are glaring. A reporter by the name of Rebecca Nagel, she wrote an article for Vice recently, and she talked with a representative from the Indian Health Services, who has, as of March 19th, said that the count for ICU beds was at 37, the count for ventilators was at 81, and the count for hospital beds was at 1,257 for all IHS facilities and for all 2.5 million people that IHS serves. So IHS is approximately funded at 1/6 of the level of what it needs to fulfill the federal trust responsibility to Native people. We also know that vacancy rates at the Indian Health Services tend to be at around 30%. So not only is the IHS underfunded historically and today, it's also short-staffed. And now, in this time of COVID-19, the lack of fulfillment of the federal trust responsibility that's based on land ceded to tribes in exchange for our health care and other things may have serious consequences for many of us. In March, in a press report from the National Congress of American Indians, the NCI President Fawn Sharp reiterated this thought by saying, we tribal nations are getting crumbs off the table. Tribal nations are the last in line when it comes to receiving PPE and tests from the federal governments and states. So for some of us, this pandemic may be particularly triggering.
Oh, it looks like we might have lost Wendy there. A second. Wendy, can you hear me? She may have lost her connection. Oh, somebody's saying she's back now.
Hi.
Hello.
Hi, geez.
There you are.
We're having a ton of connectivity problems. So when did I last kind of jump out?
Let me think what you were saying. People are typing there, helping after the quote.
Okay, after the quote. Oh, geez. Okay.
Yes, thanks for all your help, everyone.
Thank you. I'm so sorry. So another reason this pandemic may be particularly traumatizing for Native people is that COVID-19 exposes our vulnerability. We know that COVID-19 most seriously impacts those with underlying health conditions, such as diabetes, heart disease, and kidney disease. And we also know that Native people experience these conditions at higher rates compared to the general population. Finally, we know that COVID-19 threatens our elders most severely. Data from CDC from the months of February and March in a March MMWR said that 80% of deaths have occurred in those who are 65 and older, with an increased risk for those with those comorbid conditions that we talked about. Our elders are at particular risk, and our elders are our knowledge keepers and our sources that help us keep our traditions alive. So, it's undeniable that living in this time of COVID-19 has the potential to be traumatizing for anybody. But the conditions and the circumstances related to this pandemic may be particularly traumatizing, and in fact, re-traumatizing for Native people based on our increased vulnerability, the fact that it exposes these deep cracks and insufficiencies in our healthcare systems, and that it threatens our elders most. Also, COVID-19 may be re-traumatizing for an already traumatized people based on our past collective traumas. Given this, we believe strongly that a trauma-informed approach to building resilience may help reduce or prevent a trauma response in ourselves, our clients, our loved ones, and our communities during these times. And in fact, there is hope. We know that trauma reactions may occur when there is substantial perceived or actual threat. However, we also know that people often experience the exact same event, but they react very differently. Where one
Hi, this is Elizabeth speaking. If you can all hear me, I can take over from Wendy from here.
So yeah, we can
as
hear
Wendy
you.
was,
You sound good. Sorry.
Great.
Go ahead.
Not a problem. So as Wendy was saying, we can all react differently. So where one may be traumatized, others may be able to demonstrate greater resilience. And fortunately for Indigenous communities, they also have unique protective factors that they can draw on as strengths to overcome these experiences of trauma. So now I'm going to delve into what resilience is and the strategies we can use to promote it among our clients, ourselves, and our communities and workplaces during the time of COVID-19. Resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. One of my favorite ways that I have heard resilience described by was researcher Ann Maston, who called resilience ordinary magic. And she called it ordinary magic because we are all wired to find ways to recover from setbacks. It is in our neurobiology to bounce back. And that ability to bounce back is magic because it is truly extraordinary what we can endure and recover from. Nearly everyone has some capacity for resilience. So in that way, resilience is universal. It is also systemic. While some resilience factors are internal to the person, other factors are present in the family, school, peer group, culture, or community environment. And we will focus on this especially with Native communities. Resilience is contextually dependent. This means that while protective factors may be present, the ultimate effect of a protective factor depends on whether it is activated and reinforced. In other words, we can turn up resilience by intentionally creating the right environments for thriving. We will focus on this when we talk about how we as professionals and community members can make choices to impact the resilience of others. Resilience is also learnable. Some resilience skills and perspectives can be taught or learned through experience. And lastly, resilience is cumulative. Protective factors have the ability to build on each other in the synergy of resilience. First, we are going to talk about strategies to build resilience in our clients. In thinking about building resilience with our clients, it's important to draw on protective factors. Studies have found that protective factors for Native communities that promote resilience include participating in one's own cultural traditions. For example, participating in traditional activities, spiritual practices, and cultivating a positive sense of Native identity. In addition, practicing traditional indigenous knowledge about health and wellness has been shown to positively impact resilience. Connecting to community, being part of an extended family, clan, and fostering a sense of interdependence, such as feelings of connectedness between people and nature, have also been shown to mitigate a trauma response. To help understand and leverage protective factors that your client has, it's important to explore with your clients what parts of their intersecting identities resonate with them, and what parts of their identities and support systems do they draw on during times of challenge. To leverage resilience, we first need to help our clients find safety and predictability, which can be particularly challenging when many things feel unsafe and uncertain. During times of uncertainty, it can be grounding to help clients create predictable routines. Helping clients find predictable rhythm to the day can help the body settle so our minds can begin to start to process and respond to the chaos outside. With my clients, I often encourage regular sleep and wake time, since sleep is such an important component to our mental health and affects how we respond to the face of adversity. In addition, regular meal times during times of stress can help our bodies refuel. In the time of COVID, I have found with my clients that there are so many routines that we never realized that were part of our self-care until we had to change them. Helping clients recreate some of those routines, especially with transition times between activities, can be particularly helpful when work and leisure are so often occupying the same physical space. In addition, helping clients identify what is in their locus of control and to help them find some mastery can be very settling, even if it's in small ways. For example, thinking about how our clients might limit social media intake so that they're informed but not overwhelmed. In helping clients feel in control of the way they practice their own sanitation measures in their homes. Both of these are small ways that clients can start to feel some mastery over their situation. Many of the clients we work with might be in chaotic environments where home does not feel inherently safe or predictable, and that might even be the case prior to COVID-19. Helping clients to use their senses can be one way to create internal safety and grounding when it's difficult to find external safety. I often start by teaching my clients the 5-4-3-2-1 technique. I ask clients to become curious and notice with that curiosity 5 things that they can see in the moment. Have them notice 4 things they can feel, such as their feet on the ground or the temperature of their skin, 3 things they can hear, 2 things they can smell, and 1 thing they can taste. In moments of stress, our thoughts become louder and often drown out what is happening in the here and now. Helping clients to get grounded in the present can help them turn down the stress response just enough so that they can make more thoughtful actions. For clients that are struggling with emotion regulation, I often help them create a sensory calming kit that they can carry with them and use during times when they feel overwhelmed. The kit might contain a smell they enjoy, maybe hand cream or lotion, a visual they like, maybe a picture they keep on their phone, or a sound they can play, such as a song on their phone, or a taste that they like, maybe a hard candy. And I've especially used this with clients that live in households where abuse is occurring and leaving is not an option. Since many of our clients can't leave their residences right now, it can be useful to recommend that clients create a calming corner or safe space in their home that they can go to if they feel overwhelmed. They may even think about keeping their sensory calming kit there in that space. As we talked about with polyvagal theory, trauma responses activate different neural circuits. And for many clients that have experienced trauma, they often oscillate between fight, flight, and freeze, collapse. I often try to help clients learn to identify their different body cues so they know when they're entering fight or flight or freeze, collapse. If a client is experiencing fight or flight, it's helpful to have them engage in the parasympathetic nervous system and help that person calm down. Examples of calming activities might be quiet reflection, deep breathing, artistic pursuits, prayer, and other grounding exercises. And of course, ask your clients what's been calming to them in the past. If a client is starting to experience freeze, collapse, shutdown, they actually need to be more activated. So movement, stretching, pressing into the wall, trying to change environments, or even splashing cold water in their face, using temperature change. All of these can help activate the body and inhibit a freeze-collapse response. All these ways that we are helping clients ground that nervous system allows the social engagement system to come back online. And it is the social engagement system that allows resilience to flourish. While a positive outlook is a building block of resilience, I often find that many of my clients struggle to engage in positive talk and feel even more discouraged and shamed when they can't engage in authentic self-talk that's positive. So therefore, I often start with instead by introducing some neutral observing. I encourage my clients to mindfully notice what's going on with them. So for example, they might observe their thoughts and say to themselves, I notice I'm having some negative thoughts right now. They might observe their body sensations and might notice, I'm feeling some tightness in my chest, or there's that familiar pit in my stomach again. And they might observe their emotions, such as anger, anxiety, fear, loneliness. Being able to observe what is happening with curiosity rather than judgment can allow clients to build the scaffolding they need to have a more balanced outlook. Similarly, helping clients recognize and welcome with compassion their emotions will help give themselves and others more grace during this difficult time. Validate how your client is feeling and let them know what they are experiencing is a normal reaction to an abnormal circumstance. Helping clients to accept emotions can help those emotions come and go with less struggle and less shame. During times of acute stress, it's common for past and unrelated traumas and coping behaviors to become reactivated. Help your clients identify what helped them cope in the past with their past traumas or stress, and collaboratively brainstorm how they can apply those coping skills now. In addition, help your clients recognize that unhelpful coping behaviors such as substance use are getting triggered, and proactively think through what that client might do if some of those unhelpful coping strategies get reactivated. Self-care during the time of COVID-19 is especially essential because it's the daily way that we refuel and build our energy we need for resilience. One of the things I'm discovering, both for myself and my clients, is that we have to be creative in how we adapt our old self-care strategies. In addition, like I said before, we're all starting to realize the small things that contributed to our self-care that we didn't even know was part of our self-care routine, such as the processing time we had during our drive to and from work. Helping clients identify their pre-COVID physical, mental, emotional, and spiritual self-care strategies and helping them think collaboratively about how to adapt those strategies to their current situation can be really helpful during this time. Discuss ways that clients can be intentional about engaging in their self-care. One of the most important ways to build resilience is to help your clients form and maintain meaningful, deep, and community and social connections. And I can't underscore this enough, that this is such an important way. Connecting with our support system is very regulating to our nervous system. During times of COVID-19, our social connections might look very different. However, social distancing does not mean social isolation. Explore with your clients what community and social connections they found meaningful prior to COVID, and help them connect with those in different ways now. For example, if clients found talking circles, crafting circles, or powwows meaningful and connecting, encourage them to find opportunities to engage with those activities virtually. If group therapy is part of your agency's practice, offering drop-in support groups or more traditional group therapy via telemental health can be meaningful during this time. Virtual connection has never been so available. There are groups that have come to dance together, pray for humanity, exchange music, and other ideas during this pandemic. Grounding clients in their individual and community-held values can give clients a sense of purpose and meaning to the choices that they are making. The value of interdependence, for example, can help clients promote resilience in their own communities and help them feel more connected while staying socially distant. For instance, you can encourage clients to be a good relative, auntie, uncle, father, mother, daughter, son. Ask them, how can we protect one another? Let them know that protecting one another is what we've always done. Encourage clients to give back to their community. For example, participating in ceremony can connect us to each other, the earth, and all that is living. And lastly, connecting to elders while safely social distancing during this time can be a way to forge deep and meaningful connections. In alignment with values-led action, you can promote your values that your client has by using strengths-based messaging that is culturally resonant. Of course, in using affirming and strengths-based messaging, take into consideration the intersecting identities your client holds, as well as the identities and stimulus value that you bring into the therapy space. So the strategies that we just discussed to promote resilience in our clients are core strategies we can apply to ourselves as practitioners. But now we're going to build on those client-focused strategies and talk about some specific considerations for building resilience in us practitioners. As providers, we are going through a unique time because we are going through a parallel trauma process at the same time as our clients. To be effective practitioners, we need to find ways to remain grounded, present, and in connection with our clients. One of the first steps is to recognize your own current needs, your boundaries, your stress indicators, what histories are being brought up for you, and your coping mechanisms. Just like we are asking our clients to, we need also to get creative with our self-care routines. And similarly, like you talk about with your clients, think about what helps you prevent burnout and reduce stress pre-COVID-19. What are the ways that you can implement these strategies now? We need to be more intentional about our self-care as our work and home boundaries get blurry. During our discussion, I hope that we can all use some of the space today to share some self-care strategies that we have adapted during COVID-19. To be an effective health provider, it's important to be fully connected to yourself, because the process of having compassion for yourself is the same process we use to have compassion and empathy for others. It can be helpful to ask yourself, what are the body sensations I have when I get stressed? What thoughts and emotions do I have? And ask yourself how my views of myself and others and the world around me has changed when I'm stressed. And what parts of myself am I bringing into the room with my clients that are new now due to COVID? So again, the more that you're connected to yourself, the more that you can connect to others. And it's important to remember that emotion regulation and impulse control are more difficult during times of stress. People, including us, might not be showing up as our best selves during this period. and we need to give everyone grace and realize that challenging behaviors are a reflection of the stress we are under. We all need to practice patience and understanding and give others and ourselves the benefit of the doubt. Just like our clients, we also need to have a place to connect with others. It is especially important to connect with other behavioral health colleagues from both a clinical and a personal perspective. Helping our clients cope with COVID-19 calls on us to be more creative at a time where we feel collectively drained. Leaning on colleagues can be one way to crowdsource that creativity. On a personal level, we are holding stories and bearing witness to others' pain while we're also trying to make sense of our own story and cope with our own pain. Will other mental health colleagues understand the level of burnout that most of us are experiencing? Sharing with those colleagues can also help us feel less alone. So now we're going to talk about some of the more systemic ways that we can grow resilience with special attention paid to our workplace. There are many systemic adjustments that we can make to promote resilience in our communities and workplaces. First, a safe environment decreases activation and promotes rational decision-making, judgment, and attention. Being direct about how you're creating a safe environment and responding to and eliciting feedback from staff and clients not only promotes physical safety, but emotional safety as well. To support emotional safety, be as transparent as possible about policies, decisions, and give staff information when you know it. Explain the why behind decisions so people don't fill in gaps with misinformation. Uncertainty feeds anxiety, so be as consistent and predictable as possible. And of course, also demonstrate flexibility and understanding, which is needed during this time. Stress is going to heighten our awareness of nonverbal cues, so keep this in consideration when you're interacting with your colleagues. Staff will also need extra time to check in, debrief, and process their feelings. Allocating space and time for this on a routine basis will help staff be more present for their clients. Promoting choice and empowerment allows people to have a sense of agency where much feels uncertainty. Ask for feedback about policies and approaches during COVID. Give staff agency to make decisions and to be active stakeholders in this response. And lastly, build on strengths and collaborate with other organizations that may be able to leverage different capabilities than your own organization.
Thank you, Elizabeth. Liz and I have been friends for many years, and in practicing for this presentation and talking about what we were going to share, I feel like I have learned so much from you. So thank you. I know that while we were talking, there were some questions that have come up. We may have missed them. Before we start our discussion, did you have any kind of thoughts or insights, questions that came up while we're speaking? Like Kate said, the way to get our attention is to see the little guy that's waving his hand. Just wave your hand at us or write in the chat box. We see that somebody is typing in a question. And maybe, Kate, is it possible to unmute the person that's typing?
Or if they raise their hand, maybe. Let's see.
Yeah, we might be able to do that here.
I know how to do these things.
Yeah. Let's see. So Christine is asking us if we can please go back to practitioners' resilience. Absolutely. Let's see. How do I do that? Okay. Great.
If we could unmute Christine too, that would be great.
Sure. Christine, if you have a follow-up question or something specific in that, I'm more than happy, and Wendy's more than happy to try to talk.
Christine, I just tried to give you a microphone, right? So if you want to jump on and let us know your question, feel free.
Yes. And sorry, this next slide is the one that has a lot of layers, so I'm not sure which layer.
So does Christine have to?
Another participant.
Hello?
Hello?
Can you hear me?
Yeah, we can hear you.
Oh, great. So I was just wondering if you can just go over this slide again is the only question I had.
Sure, absolutely. Yeah, so I think to me the main takeaway point is that as practitioners, the more that we can get in touch with ourselves and what body sensations come up for us when we're stressed, what emotions come up, and then also what things we are bringing into the room and being aware of them as practitioners, whether that's our values, our biases, our own history, our own privileges. When we're able to be aware of those, then we're also able to be more aware of what the client is bringing to the table. So I think the more aware we are with ourselves, the more connected to ourselves that we are, the easier it is to connect with clients. And I would say that clients is the same thing. The more that they feel connected to themselves and have a good awareness of themselves and different different factors that influence who they are as a person, I think the easier it is for them to connect to others as well.
Okay, awesome. Thank you so much. That's all I
Does
wanted
that
to say.
answer your question? Absolutely.
Yes,
totally.
thank you.
And then maybe can we unmute Rafaela? And then go back to Adrian.
Yes, I think I tried to give Rafaela some microphone rights. So Rafael, if you have a microphone, if you want to ask your question, that way we would love to hear you.
So if Rafaela is not able to join us, she said, I joined a talking circle online, joined a poetry group of old Italian friends through WhatsApp. I spend time in nature and the outdoors whenever I can. I smudge and I pray daily. I connect with friends every day after putting my son to bed. I'm cooking more and I'm sharing food with my neighbors. It's really beautiful.
Those are such beautiful self-care strategies.
Mm.
I see that Adrian asked about what we suggest for families where violence is common, and I know that during this time it has been so particularly difficult. And from some articles that I've read, I have heard that domestic abuse, that there's been an uptick in that, given that everyone's kind of sharing the same space right now and everyone's under stress, and that it's been particularly difficult, especially because at least I've heard that some shelters, are not taking new people right now because of COVID, and I know it's been particularly difficult. I'd love to kind of hear what others suggest during this time when family violence is happening. So one of the things that, as we talked about before, trying to find ways to have individuals kind of find ways where they can calm themselves when they can't leave. I know that is, of course, in no way sufficient, but I know it's been a particularly difficult time to find, to intervene in the usual ways that we would when violence is present. But if anyone else has some particular ideas, I would love to hear them as well.
One of the things I was recently talking with a behavioral health provider, Donica Love Brown, over at the Northwest Portland Area Health Board. And Liz, she actually talked about one of the things that you spoke about was that you encourage people to create a safe space if they're in a home that they can't leave where there is violence, that if they can, they have their kit, that kit that you were talking about, that if maybe it's they try to have something that's grounding, a blanket, something they can smell. Maybe they have teas that they can drink in an effort to de-stress. calm the nervous system. And I know that was something that that Danica had also mentioned to me as something that she talks with clients about who are in situations of domestic violence and they can't leave for whatever reason. Does anyone else have any questions?
I see that there's one from Sheila asking about apps for Native use that we recommend for trauma-informed care.
Mm-hmm.
Wendy, I defer to you as
Well,
the health communication.
not that I have heard of, but I know that We Are Native, so I know many of us know it's we and then the letter R, native.org, has a lot of really, really good resources for Native youth. So it's a health website for Native youth by Native youth. And they're making an effort on their social media pages right now to cover some of the information that we've talked about with young people, but in really hip and cool ways. So I recommend encouraging your young people to connect with We Are Natives social media platforms and to go and check out their website, which has a ton of really good resources that you can share with your young people.
I just wanted to jump in really quick on that one too, because our PTTC has been having weekly listening sessions, and we have put together, I just put the link in the chat for the resource guide that we have put together based on those sessions. And I know that there were a couple of apps like that mentioned in it, and so I'm just looking for that here. I'll try to find that specific reference in the sheet, but there's lots of great resources on there, and a number of them are directed at youth. So yeah, hopefully that will help as well.
I love you.
So Rafaela asked, can the resources be emailed? I'm a little bit confused. What do you mean? Oh, the resources that we're talking about, of course.